This is your patient assessment medical. This station is designed to test your ability to perform patient assessment of a patient with a chief complaint of a medical nature and voice treat all conditions discovered. You must conduct yourself as you would in the field, including communicating with your patient. As you conduct your assessment, you should state everything you are assessing. Clinical information not obtainable by visual or physical inspection will be given to you after you demonstrate how you would normally gain that information. You must assume that you have 2 EMTs working with you, that they are correctly carrying out your verbal treatment as you indicate. You have 15 minutes to complete this skill station. Do you have any questions?
I do not.
You're responding to a 28-year-old male complaining of chest pain. He is conscious and breathing. You may begin.
All right. BSI, is my scene safe?
Yes, the scene is safe.
Is this my only patient?
Yes, this is your only patient.
My nature of illness is chest pain.
Noted.
I would like to go ahead and request ALS resources at this time.
ALS has been started.
Does my patient appear to have fallen at any point?
No.
I will not be taking any C-spine precautions at this time.
Noted.
So my general impression, I have a 28-year-old male complaining of chest pain who is unstable.
Correct.
My patient appears to be conscious and responsive. Is this correct?
Yes, that is correct.
All right. Hi, my name is Kawani. I am with RedLine EMS. Could you tell me the main reason you called 911 today?
I'm having pain in my chest.
Okay. So my patient's chief complaint is that he's having chest pain. Do I know any life threats at this time?
None at this time.
All right. I will now assess airway and breathing. My patient is talking to me, therefore his airway is patent.
Yes, his airway is patent.
Could you tell me my patient's quality of breathing?
The quality is normal.
And his respiratory rate?
Respiratory rate is 16 breaths per minute.
Okay. I will now obtain pulse ox. Could you tell me the patient's SpO2 levels?
Pulse oximetry indicates 96% on room air.
Okay. Based on my assessment, my patient's breathing is adequate, so I will not be administering oxygen or performing any airway interventions at this time.
Noted.
I'm going to assess circulation. Could you tell me my patient's skin condition, color, and temperature?
His skin is cool, pale, and diaphoretic.
All right. What is my patient's heart rate?
Heart rate is 56.
All right. And do I know any major bleeding?
There's no major bleeding at this time.
All right. This patient is going to be a rapid transport.
Noted.
I will now obtain a history from the patient.
Okay.
So starting with onset, can you tell me what you were doing when the pain began?
I was sitting on my couch watching TV.
Okay. Provocation, does anything seem to make the pain better or worse?
No, nothing helps.
Right. And then the quality of your pain, how would you describe the pain? Is it sharp, dull?
Crushing, almost like an elephant sitting on my chest.
All right. And radiate, does the pain radiate? Does it move anywhere?
It's in my jaw, my left shoulder, and it runs down my arm.
Okay. Severity, on a scale of 1 to 10, 10 being the worst, how would you rate the pain?
A 10.
Okay. Time, about how long ago did this start?
About an hour ago.
Okay. And then have you taken anything?
I took 4 baby aspirin, just like the commercial says.
Okay. I will now obtain a sample history.
Noted.
Allergies. Do you have any allergies?
No.
Medications. Are you taking any medications, either prescription or over the counter?
I took the baby aspirin, and I have a prescription for nitro.
Okay. With the nitro, have you taken any erectile dysfunction medication in the past 24 hours?
No.
Okay. Past medical history. Has this happened before? Or do you have any pertinent history I should know about?
I've had chest pain a few times in the past.
Okay. Last oral intake. When's the last time you ate or drank anything?
I was eating popcorn at the time it happened.
Okay. Events leading up to this. So you said you were sitting on the couch watching TV and eating popcorn. Is this correct?
Yes.
Okay. Aside from the history of chest pain, do you have any other cardiac history, such as like hypertension or CHF?
Hypertension?
Okay. Do you smoke or vape?
No.
Okay. Do I know any peripheral edema or JVD?
There's no JVD, no peripheral edema.
Okay. I am now going to listen to your lungs. If you could take some deep breaths for me. Are lung sounds present in all fields?
Lung sounds are clear and equal bilaterally.
All right. And do I know any abnormal lung sounds?
Nope.
Okay. So at this time, I would obtain baseline vitals. What is my patient's blood pressure?
Your blood pressure is currently 128/86.
Okay. Patient's heart rate?
Patient's heart rate is 56.
Okay. What is the respiratory rate and quality?
The respiratory rate is 16, and the quality is normal.
All right. And SpO2?
SpO2 is 96% on room air.
So my field impression of this patient is that he is having a cardiac episode, possibly an MI. Per protocol, after ensuring I have checked the rights of medication administration, I would now administer 324 milligrams of chewable aspirin, as well as 1 dose or 0.4 milligrams of nitroglycerin. I would then place my patient in a position of comfort and obtain a 12-lead EKG to transmit to the hospital.
Noted.
I would now reassess the patient every 5 minutes. Could I get a repeat set of vitals, starting with blood pressure?
Blood pressure is currently 106/72.
Okay. His heart rate?
Heart rate is currently 62.
Respiratory rate and quality?
The respiratory rate is 16 and normal.
Okay. And SpO2?
Pulse oximetry is 97%.
And has the patient's pain levels improved since giving medications?
Pain levels are the same.
Okay. So at this point, I would continue to reassess the patient every 5 minutes, and upon arrival to the hospital, I would provide a handoff report.
Okay, go ahead with your handoff report.
Okay. So we were called out today for a 28-year-old male who was complaining of 10 out of 10 crushing chest pain. He states that the pain also radiates to his jaw and left shoulder and runs down his arm. The pain began about an hour prior to our arrival, and he said he did take 324 milligrams of baby aspirin. Upon arrival, the patient appeared pale, cool, and diaphoretic. Breathing was adequate. I administered 324 milligrams of chewable aspirin as well as 0.4 milligrams of nitroglycerin per protocol. I also obtained a 12-lead EKG and transmitted that to the hospital. Patient's pain levels were the same after treatment, and all vitals remained relatively the same. Initial vitals, blood pressure was 128/86. That did come down to 106/72. Heart rate was 56. Last was 62. Respiratory rate and quality 16 and normal. And SpO2 was around 96%. Do you need any further from me?
I do not.
All right, then this concludes my scenario.
Thank you.